Welcome to the Children's IQ Network MU Quality Core Measures, the details of each to include denominator and numerator. This presentation will also include eClinical Works live screenshots. Adult weight screen and follow-up, 18 to 64 years of age. The actual number for this objective is on the left-hand side. What does this include? In the denominator, patients who have had a physical exam who are 18 years of age or older. They have a BMI greater than or equal to 18.5 and less than 25 at the visit or within the past 6 months. A BMI that's less than 18.5 or greater than 25. And they have a follow-up care plan for BMI recorded through preventive medicine structured data, or they have a dietary consult order communicated from provider to provider. Remember, in order for your vital signs to record appropriately, you have to use the structured data format that I will show on the eClinical Works version. Tobacco use assessment and intervention. These two go hand in hand. Smoking status is checked on every patient 13 and up, but at age 18, it's looking for more specific information. So 18 years and older, and they meet one of the following: 2 or more office visits, 1 or more preventive medicine service visits, and tobacco use intervention. 18 or older with documentation in the tobacco control smart form of a current or former smoker within the past 24 months and have had 1 or more preventive service visits or 2 or more office visits. These two go hand in hand in the fact that you do the smoking form or tobacco control form under smart forms on every patient 13 and up. And age 18, it's saying, okay, if you mark current smoker, you must have documentation that you have done an intervention, whether that be in preventive med section or smoking cessation medication ordered within the past 2 years. Same for if you mark former smoker and it's within 24 months. Those are how those are calculated. Hypertension, 18 years and older. If there is an active diagnosis of hypertension in this patient's record, or a BP recorded in the last 2 patient out visits with a hypertension, it's in the denominator. The numerator is documentation of a systolic and diastolic blood pressure, vital sign using structured data format, and the vitals taken is checkmarked. Child weight assessment, 2 years to 17 years of age. All 2 to 17-year-olds. Has nothing to do with physical exam. It's the age. So in other words, this age patient, 2 to 17, they have an office visit, they're in your denominator automatically. Numerator is calculated based on is the BMI percentile recorded. The only way to get your BMI percentile recorded is obtaining weight and height, because those are needed to calculate the BMI. You must use this pop-up window structured data format and vitals taken when doing the weight and height. Yes, there is a way to set the system so that you can automatically bring heights forward. That's okay for the 18 and up, but I wouldn't do it for the underaged. Nutrition counseling and activity counseling, this is every visit, every patient. So therefore, it is, again, looking 2 to 17. They have an office visit. They should be being counseled on nutrition and activity. We do it, but it's a documentation point that pings your MAC data. That is done through Preventive Medicine Structured Data Documentation section of YES. Go to Preventive Med, Communication, Counseling, Nutrition, Activity, etc. And I'll show that in eClinical Works. Pediatric additional clinical quality measures can also include asthma assessments, appropriate medications for asthma pharmacological therapy, and appropriate testing for children with pharyngitis. The details in the asthma section. Appropriate medications for asthma, this is ages 4 and up. You'll see all different ones listed here. These are the ones that have been determined that pop those patients into your denominator. And there are certain diagnosis codes. Now, if they have cystic fibrosis or COPD, something like that, those patients, if you also put in those codes along with your asthma code, they're automatically excluded. This is strictly looking at asthma itself. More details on that is a pharmacological therapy one. It's a diagnosis of mild, moderate, or severe persistent asthma prescribed either the preferred long-term control medication, inhaled corticosteroid, or an acceptable alternative treatment, and have 2 or more office visits. For this one, you must use one of the 2 following methods. Only one can be mapped, so the entire office has to use either the asthma smart form to record the diagnosis, or you use the HPI asthma severity classification and ensure that that section is mapped. Both cannot be mapped, so you must use one or the other. If you have a different documentation point in the office that every single person is using, you can contact me. I will show you how to map that, but if you ever make any changes, it will have to be remapped. There's only one documentation point available per practice. Pharyngitis. Appropriate testing for children with pharyngitis. And it just automatically, you'll see it looks like a typo. Don't worry about that. That's just the shortening that it does in the MAC-DASH. Is 2 to years of age, diagnosed with pharyngitis and pharyngitis antibiotics medication ordered, or active in the active medication list with a medication for pharyngitis within 3 days after ambulatory office visit, and a pharyngitis antibiotics medication has not been ordered or active within the past 30 days before the office visit. It's looking for group A strep. The lab test is performed within 3 days before or after the office visit or simultaneous to the pharyngitis medication being ordered, listed as an active med, and within 3 days after the ambulatory visit. That's what goes into your numerator. The codes are 034.0, 462, and 463. And LOINC, this is part of your lab setup. If you haven't done even your in-house lab for your rapid streps, you need to put one of these LOINC codes in there, so it will also pull that information to pull this data appropriately to your MAC-DASH. Hello, this is the clinical portion of your clinical quality measures. First, I'm going to show you about the hypertension. Age 18 and above, if you have a diagnosis of hypertension in an assessment or in your problem list, the age 18 and above must have their blood pressure recorded to meet the objective. They will be in your denominator if they have that hypertension diagnosis in the system. Blood pressure must be recorded using the vital signs appropriately by using pop-up windows. You'll come into here, record the blood pressure. You can add a qualifier and move it over and hit apply. Then you must also check mark vitals taken. That meets that particular measure. So let's now move on to weight assessment and weight screen is the other one. Again, you must use the pop-up window. Come into the system using either the kilos or the pounds, whichever one you prefer to use, and pop it in and hit apply. Then do your height. You can either bring the height forward for an 18 or older by setting a setting in your system. You can copy the height from the previous height that was taken in the system, or you can record the new height as needed. And when you click apply, you will see it's going to figure your BMI. In this case, it's less than 18.5. You're looking for those cutoffs of 18.5 or less and 25 or greater. So if I was to come in here and delete this, and I'll pop my patient in with excessive here, and now you will see I have my BMI greater than 25. If I have a BMI greater than 25, the system is also saying now that each time that patient comes in and their BMI remains that or greater, or has been 25 or greater the past 6 months that it's calculating they've been in or have one recorded in the system, you must come to preventive medicine and you must do your counseling. Counseling, care goal follow-up, BMI management. You see how it's in blue? That means it's mapped to community mappings. In this case, it'd be my meaningful use. And I pop in my yes, that I have talked to him about BMI management. That now met that criteria. The same for the weight assessments for all patients 2 to 17. It's the same thing. You do the weight and height because it's looking at the BMI. And then you have to do your counseling. Now, this is for every patient, though. Every weight, every height, every visit. The patient should be counseled on nutrition, yes, and physical activity, yes. And then close. This has nothing to do with the routine physical exam in this case. So let's talk about the tobacco assessment for the age 18 and above, with smoking screen, of course, being 13 and older. Come to Tobacco Control Smart Form. Smart Forms are located right up here in the left corner. Come to Tobacco Control. If they are a current smoker, it will open up other questions, and former smoker will do the same. It is looking in the system for this current or former smoker, and if they are a former smoker within the past 24 months, the system then says, okay, in order to meet the second part of your tobacco assessment in the clinical quality core measures for 18 and above, if it finds current smoker or former smoker, it's going to look for preventive medicine counseling on smoking being done in order for it to be in your numerator. Otherwise, you'll have it in your denominator. It won't be in your numerator. Therefore, you don't get your credit. So you come right here, you pop in the date, which is just simply a clickable field, and you close. And now you have your information in the system. So long as everything is in blue, you know it's mapped appropriately. Let's talk about vaccines, because I didn't talk about that on the actual PowerPoint. The vaccine portion is easy. First of all, it's going to check every single visit, that reporting period, that has somebody in the system that says they're 2 years, 2 in 1 day, 2 in 364 days. It's going to run through and it's going to look for 4 DTaps, 3 IPVs, an MMR, 2 or 3 ROTAs, etc., etc. Okay? That you can go under CDC, Meaningful Use CMS, several places, as well as a worksheet that I have. But where do the problems come in? 2-year-old comes in for a sick visit, first-time patient, we don't put their historical in. It's a missed opportunity. Okay? We don't pop the historicals in before the patient leaves, or the vaccine record or the progress note is locked. It can't associate it with that particular visit. It can also be the way historicals are entered in. I have ran across that in one system, and that you do go to immunizations and enter a historical vaccine in on the progress note, but I haven't seen that being a big issue. Your alternative vaccination patient, okay, if they're not up to date, that's a problem. But the biggest problem is right here, immunizations, CVX codes. CVX codes is the system, just like CPTs are, that will be attaching to registries, but is also the one used for the MAC- reports. So, for instance, maybe you have a DTaP in the system that's used for historical, because you don't maybe give the monovalent or the monovalent combo in this case of DTaP. If you don't have your CVX code in here, it's not going to count correctly for you. So for instance, DTaP HIM in our case is mostly historical. You've got to be sure to have your CVX codes. So you need to run through your entire system and be sure that everything you have in the system has a CVX code attached. Whether you bill for it or not, you have to have a CVX code in the system for it. So now let's talk about the asthmas. The asthma ones are additional alternative that are pediatric specific ones. There's only one or the other method that you can use for this one. Now you will notice when I hit smart form asthma, mine's not going to come up. That's because we don't have ours mapped. We're using a special format. But if you have yours mapped, you can record your information through that asthma smart form and it will be automatically mapped to your Mac Dash through these community mappings, smart forms, asthma, and then it will show you everything over here that it is mapped to within your HPI, and it's mapped into this section right here. Okay? In my case, again, mine's mapped slightly differently. It's not mapped to the asthma form, but you can see how you can map it. But if you do use an alternative place in your system, the only other place is the HPI where you can map. Everybody has to use the exact same documentation point in your facility, not office, but the entire practice, in order for it to record in your Mac Dash. So if you are using an alternate place in your system, you'll need to come to HPI Asthma, and then you'll need to find the place in your own system where you're documenting severity and the number of daytime incidences of wheezing and coughing or shortness of breath, and the number of nocturnal days of wheezing, shortness of breath, etc. Those are the ones that it's looking for. So in my case, we have this new asthma visit that we use, and we have our stuff mapped accordingly there. Okay, so you will see blue to blue, and to include also the severities and stuff are also mapped into a different portion. Okay, so if you don't have those, then you've got to do one or the other to map to get those credits in there. Pharmacological, it's looking for certain medication types, and that entire list is on that PowerPoint presentation. If you need that, just let me know. I'll send it to you, but you can also find it on eClinicalWorks under Documents, under Meaningful Use, Stage 1, under the pharmacological. It takes a little while to find. Pharyngitis, what is that one? Well, let me go back. Yeah, the pharyngitis one. Okay. It's going based on the pharyngitis codes, and it's looking specifically to one, if you have the pharyngitis code in there, and it's looking at the lab. It's looking at the LOINC of the lab. That includes your rapid strep and your cultures. So for instance, rapid strep, attribute cones, it's looking here for this LOINC. If you don't have your LOINC in, just click on it, update, and the easiest one to find is 547-0. Pop it in, and it will automatically pop it into there for you. And be sure your cultures, if you're only doing the culture and you're not doing the internal rapid strep, be sure each one that you have for your cultures, whether they be interfaced or not, be sure to come in and pop that in to your attribute code so you have the LOINC, because it is looking for that. There are other LOINCs listed in the PowerPoint that can be used as well that the meaningful use can pull, but the 547-0 is the easiest one to find in the system. Pharmacological management for asthma, again, is looking at medications, so be sure you're keeping your current medication list up to date and that you're continuing the medications in the system. What do I mean by continuing? There is something called continue. You see my current medications over here on my list? I can either come here and hit my C for continue, It's already added in the system because I've been using this one a lot. Or I can click my C for continue. And now I have popped in my order to continue the medication right here. Or I can come to treatment, go under current prescriptions, and I can come right here, perform actions, and continue all. That's just a documentation that we are continuing, not necessarily prescribing them. We're not refilling them or prescribing them. We are documenting that we're continuing. When you go to e-prescribe, you will see it is not checkmarked. It will not send to the pharmacy. However, there's nothing wrong with going ahead and sending that to the pharmacy. So that kind of goes along with several things in the system. Not so much quality measures, but other portions of meaningful use. And I just want to add that in on this presentation. If you have any questions, contact me and we'll see what we can do. But most of the quality measure issues is set up, not using the mapped sections, and not using structured data, just like within the other MU, but especially in the quality measures. Thank you.